Hello and welcome back to Silvia's Health Hints. In my last video I gave a short introduction into pollen allergies, and today I would like to talk about one of the treatments for pollen allergy, the immunotherapy for hay fever. Allergic rhinoconjunctivitis, hay fever, the allergy to pollen, is an immediate type allergy mediated by IgE, immune globulins E. Pollens are produced by plants for the purpose of reproduction. During the flowering period, they can be found in large quantities in the air. They contain potent allergens, proteins, that can trigger an immune response. Symptoms appear immediately after contact with the pollen and usually affect eyes, redness, swelling of the conjunctiva, increased tearing, itching and swelling of the eyelids. The nose, runny and stuffy nose, frequent sneezing, itching, and compromised sense of smell. In addition, discomfort in the throat and skin rashes can occur. A complication of the pollen allergy is when the respiratory tract is also involved, with a dry cough and asthma, which even can be very severe. Preventing hay fever by avoiding the allergens as much as possible is very difficult. Various medications are available to treat the symptoms. Specific immune therapy can be attempted in patients who do not respond good to the symptomatic therapy. The aim of the desensitization, how we call it, is to gradually get the patient's immune system used to the allergens until it no longer reacts allergically. In contrast to the conventional therapy with antihistaminics and steroids, which are immune suppressive drugs which alleviate the symptoms, immune therapy is causal. That means that it treats the cause of the symptoms. And the cause is that the immune system is overreacting to harmless proteins. The therapy consists of a continuous supply of purified and standardized allergens, the substances that trigger normally the allergic reactions in the patient, and leads to gradual habituation. The allergens can be administered subcutaneously with injections, injected under the skin, or sublingually, given under the tongue. These are normally drops or dissolving tablets. Therapy usually starts before the pollen season and then needs to be continued for a determined period. It depends a little bit of the product, of the allergy and of the patient. In most cases, the therapy leads to a significant improvement in the symptoms over the time. That means to less severe allergic reaction. In many cases, even a cure in which there's no longer any reaction from the immune system. In my practice, I carry out as well the subcutaneous injections and also the oral immune therapy. The oral immune therapy has the positive aspect that you need to come to the office only for the first 2 or 3 times for the first administrations, just to be safe that you don't have a severe reaction, and then you can continue the therapy independently at home by yourself. It's a longer therapy. The subcutaneous injections, there are at least products that you do it only for a very short period every year, for example for 4 weeks. And some of my patients, for example, they prefer this kind of therapy because they don't need to think every day to take the tablet. So it's something individual. It depends also on your allergy, which product is available. But this can be discussed with your doctor in case you would like to do a desensitization and immune therapy for your hay fever. Thank you very much for watching this video. See you next week.